Okay, got this question on one of my videos and I'm super excited to talk about this. I'm 38 weeks and my hemoglobin or blood count is 6.2. The on-call doctor blamed this on me eating ice. How is that possible when it's just frozen water? What you are describing is something called pica, P-I-C-A. Let's chat about it. Okay, so pica is the craving and intentional consumption of substances not culturally defined as food. And there are three main types. First, you have geophagy, and that's the consumption of earth, including soil or other earth-rich items like adobe, clay preparations, pottery, or bean stones. Then you have amylophagy, the consumption of raw starches, including cornstarch, laundry starch, raw rice, and flour. And then you have pagophagy, which is what this is. That is the consumption of large quantities of ice or freezer frost. Pregnant individuals by far are the largest group of patients that have pica. Now, this is a table you could pause to read that has the clinical sequelae of pica by the item ingested, meaning the item ingested here, and then what the potential clinical sequelae or consequences are. So pause to read this. But if you go to ice pica, the potential consequences are low gestational weight gain, jaw pain, dental damage, and hyponatremia, or low sodium, and anemia. Pica, especially of ice, can cause a low hemoglobin. Now, I could talk about pica for another hour, but I won't do that. If you think you have pica, again, look at that table I just presented and see if you're eating a bunch of any of those things. If you are, and you're concerned that you have it, please let your obstetrical care provider know. That way they can properly evaluate you, do the whatever laboratory tests are indicated, and then find a way to manage this. It is something I feel that is not talked about a lot. I feel like it happens a lot though, and we need to pay more attention to it as obstetrical care providers and also as patients who are pregnant. So please take a look at that table, see if there's anything on there that you might be eating a lot of or consuming a lot of. Let your obstetrical care provider know.